G'day guys, my name is Alex. I'm the sports physiotherapist. Welcome back to my channel. Today I'm going to be taking you through my knee brace protocol. So if you're someone that suffered an ACL injury, MCL injury, LCL injury, or PCL injury, and even if you're someone that's had a meniscus injury or a knee replacement, these exercises are for you. There are some small adjustments for different types of injuries that I'll explain as we go. So these exercises for the most part are appropriate for anyone that's in a brace because these are for when you're non-weight bearing and not allowed to put weight sort of through that leg after surgery, because we want to maintain as much muscle bulk as possible. If we lose muscle around our knee, it's going to make it a lot harder for you to get back to sport and activities that you were doing prior to injury. Because if you lose that strength around the knee, you lose that control and muscle bulk around your hip as well, it's going to make it much harder for you to do the sport that you want to do. And more than that, it's going to increase your chance of re-injury. To maintain that muscle bulk, we're going to be doing exercises about 4 times a week. And for each exercise, we want to be doing 2 to 4 sets of 15 to 20 repetitions or more, depending on your ability level. You might think, well, why don't I do them every day? Well, one, your knee's going to swell up and get really sore from doing that much exercise. It's just had a major trauma to it. And it's going to need rest for 1, pain, 2, for swelling, and 3, the muscles need to recover if you're doing the protocol correctly. Certain exercises like range of motion, I think, should be encouraged every day. So guys, for the sake of this video, I've got my little green sock on here. I've got some Tasmanian devils on there to remind me of home. This is my brace leg. I don't have a brace with me. I wish I did. However, as I said, it doesn't matter what range of motion you're stuck in. You could be stuck in 45 degrees, completely straight, or somewhere in between. It doesn't matter because this is a non-weight bearing brace protocol to be done on the mat, with maybe one variation that can be done in standing if you prefer. There'll be some exercises that I suggest not to do with certain injuries, and this is more to do with the MCL and the LCL injuries, to do with certain leg raises. We may not want to stress that site too much, and I'll go through those when the time comes. So guys, we're going to jump into that first exercise. If you have any questions at any point in time, please drop them in the comments, because other people may have these questions as well, and I can hopefully give as much feedback and value to you guys as possible. So guys, let's jump into the first exercise. Let's start with exercise 1, which is a straight leg raise. The straight leg raise, we want to make sure that our leg stays locked because we're trying to work our quads. The quads are a knee extender, so they make our leg go straight. This is going to be our exercise to build and maintain strength in that quad. All right. So it doesn't matter how much range of motion you've got, depending on how much your brace is restricting you, but we just want to have our leg as straight as possible, okay? So lock the leg out, bring your toes back towards you, raising up, coming back down. We want to repeat that 20 times, 2 to 4 sets, okay? Nice and steady with your pace. Don't go too quick, okay? Because we want to make sure that knee is as straight as possible so that we're engaging our quad. If that becomes a bit too easy, you can bang out those 60 to 80 reps. You should be having a few minutes rest in between sets, between 2 to 3 minutes rest between sets. We can then add a resistance band around the tops of our legs like this. Depending on the size of your brace, you may want a bigger band that can sort of be tied together and looped around your brace, depending on how bulky it is. Both legs down, toes back, raising up, and that band is just applying that bit of extra resistance to my leg. Okay. If I had a weight, I could place that weight on my thigh to make it a bit harder if you didn't have a band at home. Okay? So our next exercise is going to be a side leg raise. This is going to work our glute muscle or our glute med. Really important for that stability in our hip. So once again, this leg with the sock on is the brace leg. It's going to be lying on my side. Sometimes it's nice to have a wall behind you, because some of the common mistakes is, when we do the side leg raise, we roll too far back. So what we want to see first is bottom knee up. This leg is locked out straight, toes are back towards me, so my quads are engaged. And I'm raising up side on. This leg shouldn't come in front and do that. And I shouldn't be rolling back and doing that, because that's going to make the quad work a lot more. We're trying to get the hip to work as much as possible here. So be side on, bum almost against the wall, heel comes back, hits the wall, and I'm just running up and down the wall just gently. 2 seconds up, 2 seconds down. I'm trying to keep my knee as straight as possible so that my glutes work. If I bend my knee, it becomes a bit easier, and we're not biasing our glutes as much. So keep the knee straight, toes back, raising up, okay? And our progressions can be the same again. Bend that leg a little bit, raising up, come back down. So once again, 2 to 4 sets of 20 repetitions, okay? I can use a weight again, so if this was a weight, I could hold that here to add that resistance and make it that little bit harder, provided I can keep my technique of leg straight and I'm not rolling back through my hips or trying to use my quad. I'm trying to use my hip muscles. Whew, nice one. All right, guys, it's time for exercise 3, which is a hip extension or a reverse straight leg raise, if you will. It's really nice to have a few big pillows to pop underneath our hips because we're trying to extend up as much as possible. If you're lying flat on the ground, you're probably going to be using hips, but also your back a little bit. We want to try to take our back out of this as much as possible and just use our glutes. So I'm going to be talking about pelvic tilting, and I'll link a video that explains the pelvic tilting a little bit more. But think of your pelvis as a bucket. Depending on our posture normally, some of us will be really arched in our back and the bucket's tilted forward. Others will be sort of tilted backwards. We want to be tilted backwards for this exercise. So think about lifting pelvis up or tucking our pelvis underneath ourselves. This is just going to mean the glutes are going to work harder. So I'm tucking underneath myself when I'm lying down and doing this exercise, okay? Before we start, we want to tuck underneath ourselves. So we don't want to be arching and it's all in our back. We start to get twisting in our hips. We want to be tucking underneath ourselves, squeezing the glutes a bit, and then raising up. So really make sure you set up, you tuck underneath, and it's that slow, controlled glute raise. So notice that the range of motion isn't very much. If you're progressing really well, we can add that resistance. There's a variation to this which is great. So tuck, raise, and then come out to the side. So you end up doing a bit like an L shape. So I'm raising up and then coming out. I'm still making sure my knee doesn't bend. I'm not trying to like raise up with the knee bent. I'm keeping my leg straight. And guys, that's really hard, really challenging, but it works those glutes well. In this position, we can do a hamstring curl depending on the amount of range of motion that you've got. Okay. We may want to add some resistance. I'm popping the band around the middle of my foot, not up my leg, so I can trap that band and get a hamstring curl. Saves you having to attach it onto something. If you're someone that's had a hamstring graft, it depends on how long post-op you are. Generally speaking, you want to leave the graft side alone. So if you've had a hamstring graft from an ACL repair, you probably don't want to annoy it too much, and just the range of motion moving by itself without any band is probably the way to go. So guys, we're going to do leg adduction now. So instead of the side leg raise, we're doing an inside leg raise, okay? So you want to set up in this position, have a pillow here, pop that leg on top, and this bottom leg is raising up. And I think this is important if you're someone that plays a running sport or a heavy change of direction sport. Having a strong groin is important, and the groin only really gets that aggressive loading from things like running and changing direction. So it's just a nice exercise to keep all the muscles around your hip and your legs working. So doing the inside leg raise is a great way to strengthen those groin muscles, as you know, you're not running at the moment, and those groin muscles get stronger from, you know, running and cutting and changing direction. So it's just making sure that they're getting some work as well. Make sure that knee stays straight. We're not bending the knee to do it. Leg straight, raising up. I don't think you need to do too much resistance adding with this exercise, okay? So depending on your range of motion, doing some knee extensions is going to be a good exercise for you. There is some conjecture about whether you can do knee extensions after an ACL repair. It's been said that you shouldn't do knee extensions prior to 12 weeks or 3 months after your operation. There is evidence to say that you could do it to 45 degrees after 6 weeks, and then you can do them after 12 weeks, full range of motion. But that's just what the evidence is saying at the moment. I've got my loop, so I placed it underneath my arch. I've crossed it, and then I've looped it underneath my foot. And that gets you this nice crisscross, which I can then hold on to. And I can do my knee extensions like that to get that quad working. I suggest if you've got the range of motion to do this, it's great. But like I said, with the ACL patients, it just depends on who you talk to. But great way to build some strength. It's fine. I'm not putting any weight down through the leg at all. So it's fine to be doing. So we also don't want to neglect our calf muscles as well. We need them to run. They're a really important muscle group. If you're stuck straight in the brace, we can just do basic calf extensions or push downs like that. And that's fine. Just extend all the way. Get that calf to switch on. Perfect. If you've got a bit of range of motion and you can get into this position, we can add resistance. So if we have a little bit of weight, we can just add a bit of pressure on top through my arms, raising up and down like that. If I had a weight plate or something I could place on there, I could just do that also. It's going to be pretty minimal compared to your body weight. So if you're allowed to do touch weight bearing or partial weight bearing, this will be fine. If you're supposed to be completely off your leg, just go with that banded version where you push out like that, okay? So there's one option that we can use with a brace protocol for our hips. So not putting any weight, all my weight's on this right leg. The band is around the middle of my foot, and it's doing a side leg raise. So side, 45, straight. Side, 45, straight. Make sure the trunk's fairly stable. I'm not arching through my back or leaning through my trunk. Nice and still, back, angle, side. Back, angle, side. This brace protocol is really important to begin early. It's going to make sure that you maintain strength, maintain size, and get you back to, you know, exercising as soon as possible. The worst thing is when, you know, the knee itself has healed, but the muscles aren't up to scratch, and then you go back because it's been 6 weeks, 8 weeks, but you haven't looked after your muscles, and you get another injury on top because we just didn't do the rehab early enough and you suffered another injury. And we just don't want to fall into that trap, guys, because one ACL injury is more than enough, one MCL injury is more than enough. So I really hope you've enjoyed this video. If you have got something out of it, guys, please subscribe so that you don't miss out on any more videos as they come out. I'm going to pump out a load of knee related content, as I've got a few friends of mine that are undergoing ACL reconstruction at the moment. So guys, please subscribe so you don't miss out on any further videos, and I'll see you in the next one. Cheers. Thanks, guys.